This is my IV insertion video. So I'm going to start by checking the MAR and the record and the order for an IV. I'm going to gather my supplies, knock on the door, provide privacy, wash my hands, introduce myself to the patient. Hi, my name is Baylie. I'll be inserting IV in you today. Do you have any questions? Can you tell me your name and date of birth? Okay, and do you have any allergies? Okay. So after I gather all my equipment and everything, I'm going to raise the bed up to a comfortable working height, place the patient in semi-Fowlers. If needed, I will change to a gown that is easier accessible with snaps. I'll ask them about their preference of dominant side and where they would like the IV. I would then put on the tourniquet and check for places. I would then wash my hands and cut. When selecting a vein, I would choose a well-dilated vein that is most distal on the arm, not on the thumb or palm side of the hand. And then I would gather my stuff, I would wash my hands, and I would put on my gloves. I would apply warm compress for several minutes, and then if the site looks like it needs cleaned, I would clean with soap and water. I would open up my package while keeping aseptic technique. I would prep my saline flush, make sure there's no air bubbles, and then lock it, and then place it back in the sterile container. I would apply the tourniquet 10 to 15 centimeters above where I'm going to insert. And then I'm going to use chlorhexidine in a vertical and horizontal direction and then in circular. Allow that to dry. Then prepare my needle. I would anchor the vein 4 to 5 centimeters below my insertion site. I'll keep the needle flush with skin and insert bevel up, and then perform the venous puncture. Observe for flashback. Then keep a firm grip on it and release the needle. I would take off the tourniquet and connect the lip lock. I would aspirate for blood and then insert and check for swelling. Then I would secure the IV with a piece of tape. And then I would apply the dressing per facility policy. I make sure to initial and date the time that I am placing the dressing. Dispose of everything in 2 sharps. I would clean up my equipment, put the bed in the lowest position, call lights within reach, side rails up as ordered. Is there anything else I can do for you today? Thank you for letting me take care of you today. I would dispose of my supplies, wash my hands, and document insertion site, time, type of catheter, number of attempts, flushes used, and patient teaching.